Great. Well, thank you all so much for joining in and listening to my presentation about Health Core programs, scholarships, and loan repayment. So this is going to hit on some of the high notes of kind of preparing for and the opportunities and being a part of a scholarship or loan repayment program that is a part of our Health Core model, whether that's state or national. And uh, I'm Cori Garcia-Hansen. I'm the Center Director at the Area Health Education Center for Western Washington. And we are a part of the Washington Health Workforce Gateway. And this is a collaboration across several organizations to be able to provide presentations about these opportunities in these health core programs, as well as some other ways to connect into working into underserved communities. So our coalition currently is composed of the Washington Association for Community Health. That's our primary care association. They also presented this week as a part of Sound Careers. We also have our regional office for the National Health Service Corps that participates in our coalition and informs our work. It's largely coordinated by the Washington State Department of Health. They help with some of the funding to help pay for our travel and our time to be able to deliver these presentations. So we very much appreciate that. They also have worked in partnership with an organization called 3RNet, which I'll mention a little bit in the presentation, to be able to build a website that keeps all these wonderful resources about these programs in one place, which is really helpful because otherwise you have to kind of go all over the internet searching for these programs. In our state, the Washington Student Achievement Council is who manages our state health core program. And this is our state-based loan repayment program. And lastly, we have the area health education centers. And so we're kind of, we're these federally funded programs. I won't be able to spend too much time on an area health education center in this presentation, but essentially our job is to work across the country in a network of centers to help address the shortages of health professionals in rural and underserved areas. And our three strategic priority areas are to improve the diversity of the healthcare workforce, to provide better culturally and linguistically concordant care, which just means that you have a healthcare workforce that's from your community and understands your needs as an individual better sometimes than others do by speaking your language and understanding your culture and your beliefs around healthcare. And then we also work on distribution. So we look at some of the issues around how many doctors and nurses are available, for example, in one location or another. And we also look at behavioral health and dental as kind of key indicators of where we have health profession shortages. And we work with larger workforce development groups to be able to assess what's happening in any given area of healthcare. So beyond those key indicator areas around that primary care, clinical care, behavioral health, and dental, area health education centers also look at some of the challenges around staffing our IT and administration, labs, kind of the whole spectrum of healthcare, public health, school-based health. So our jobs are really to kind of be a part of a larger network and support that network to address diversity and distribution of healthcare professionals. And then we also provide a wide variety of trainings that help with the professional development of students and working health professionals who are invested in improving the healthcare in underserved communities. So what do we mean when we're saying underserved? And one of the challenges around some of this work is some of the language and jargon. Sometimes it can kind of be more negative based language, which really sometimes doesn't feel so good if you come from a community that is labeled as underserved. Unfortunately, at this time, we don't have better labels for it. And I hope, we kind of get to a place where we have a better way of describing some of the problems and challenges that are in our healthcare system and how we work with communities to address these issues. But as of right now, this is kind of a primary term that you'll see used to be able to kind of categorize different communities in which we see what we call healthcare disparities. So we have a variety of other kind of healthcare indicators such as prevalence of different types of disease, how many people are insured and have access to health insurance, how many people are accessing healthcare, compared to what we know about our estimates of how much of any given disease or health issue is in a community. And what we find is that primarily our communities that are experiencing these disparities are our communities of color, immigrants and refugees, migrant workers, tribal communities and nations, our under and uninsured populations, our older adult population, the LGBTQ+, veterans, those experiencing homelessness, youth in and exiting foster care, and formerly and currently incarcerated individuals. So our healthcare programs that serve these populations specifically are a part of what we call our healthcare safety net. And that's where we're trying to get people to work. We're trying to get them excited about working in these communities to help address some of these disparities or lack of services. The Area Health Education Center for Western Washington works with the primary care office at the Department of Health to put out the report for our state that describes kind of the status of our access to healthcare and underserved populations. So on our website, if you wanted to learn more about Washington State and kind of what's going on in Washington State around medically underserved areas, that's a great resource. So some of the populations that we are in particular looking for people to get excited about working with are some of the really wonderful communities that come to Washington State to find a new home. So Washington has actually a significant history of welcoming refugees into our state. In this case, you're seeing an article from the Seattle Times, which was highlighting how one of our downtown public health centers is working with refugees. And this is one place where health providers can get involved. I remember this was, my husband, when he was coming here as an immigrant, we had to get his medical exams done to be able to go through the process of immigration. And it was a really scary experience. And so many communities know what that's like because so many people are immigrants in our country, right? And so we really need these providers who specialize in this care to be able to welcome these communities and people to our state. And to help them connect to resources immediately once they get here. This is one of the first things that sometimes you have to do when you're filling out your paperwork. And so it's a wonderful access point to refer people to services across the community. So you can either be working as a physician, or there's a wide variety of ways you can interact with refugees and immigrants, such as social work and nursing and financial case management, just to name a few. Another really wonderful population that we have in our state who is in need of more health professionals to serve them are our migrant farm workers. And this is really important to our state. This is a huge part of our economy and our well-being. And of course, everyone eats. So we can be incredibly thankful that we have so many people that come to our state to help pick the food and package it and send it off to our grocery stores for us to eat. They are a critical part of what make us healthy. I mean, when we saw that presentation from Sophia on the first day, she talked about kind of some of our health behaviors and access to food as being some really critical pieces of what makes us well. So we really want to do a good job treating and creating a healthy community for our migrant health workers and other farm workers who contribute to the health and wellness of everyone across our state and country. Rural areas are also in great need of health providers. And there's some really beautiful places in rural areas. If you love the outdoors and you love kind of the small town feel of being part of a small knit community, this is a really wonderful place to work. And often these people have to travel so far to reach healthcare. And even if you don't live in a rural area, when you become a healthcare provider or you're a part of maybe an administrative or public health programming, making the decision as a professional to create telehealth resources or outreach programs that enable rural communities to access more healthcare is a really wonderful service to expanding our healthcare. as you're developing as a professional, doing service learning and community volunteering is really a great way to develop your resume and to prepare you for a health core program. Some of the places that you can serve in a health core program are community health centers, rural health clinics, hospital affiliated primary care outpatient clinics. A lot of our critical access hospitals have these. Indian Health Service and Tribal and Urban Health Center Core, Indian Health Clinics, as well as our state and federal correctional facilities. There are many other places, so I'm going to kind of cruise through these, but there are lots of places to work. As you heard me say, we kind of have this way of assessing where we spend our money on our health core and loan repayment. And as Jesus mentioned on the first day, these programs basically are saying, we'll give you scholarship funding when you're a student in return for your commitment to working in an underserved area. Or once you've graduated and you're a working health professional, we'll help you with loan repayment if you commit to service in one of these areas. And each one of those clinics that you saw have to sign up, and they get a number assigned to them called a health profession shortage area score. And the higher the score, the greater the need for health professional. And then you as a health professional apply with them or are placed there if you're doing a scholarship program. And so it's kind of a package deal where we are targeting funding and professionals into the areas of highest need. So National Health Service Corps. So there's a scholarship program, there's a students to service program, and a loan repayment program at the national level. And at the Washington level, there is a state health program, which is a loan repayment program that's kind of our general. It's kind of similar to the National Health Service Corps' main loan repayment program. And then there's a behavioral health program that's specific for behavioral health providers and those working in behavioral health. And then matching with our state health program, we have a federally funded program that also helps us to increase the number of people that we can send to sites and provide loan repayment. So to be a good applicant, you kind of need to develop up this background and history that demonstrates that you are committed to an underserved community. Some of that can be demonstrated in your volunteer time or where you do your internships or fellowships as you're developing and residencies as a professional. And some of that is also just who you are and where you're from. So these funds are also prioritized for students who are from any of those underserved populations. So if you're a student of color, if you speak multiple languages, if you come from a low-income background or a rural background, for example, have diverse abilities or other backgrounds that help you kind of understand and you have that lived experience of what it is to access healthcare in an underserved community. And you get an opportunity to do an essay and kind of describe that to them and kind of tell them why you're committed to it. Ultimately, what they want to see is people who are more committed to doing this on the long term versus folks who just want to kind of do it for loan repayment. Also, this is, we prioritize that, right? Because we want to build stability in these areas. We want people to stay there on the long term. So for the scholarship program, essentially for every year of scholarship that you receive, you have to do a year of service, but they have a minimum of 2 years. So you have to know in your program of your four-year degree or your health profession program, excuse me, that you want to work in an underserved community to be able to commit to this. Some people are not quite ready at that point in their development to be able to sign on to this program, but for some people, they just know this is what they're going to do, right? And so this is a great way to make sure that you're actually not getting out of school with so much debt, but it does mean that you will do service immediately after graduating. And sometimes you are being asked to go where there is the greatest need. So you would also need a little bit of flexibility in where you go to work. Sometimes though they are able to work with you to go to work at a specific site that you may be already in service at. To be eligible, you must be a US citizen or a US national at this time. It's important if you're interested in these programs to go ahead and sign up on their listservs to get regular updates because these programs get updated all the time. And I'm hopeful that at some point we may change some of our requirements around eligibility, and it's important to kind of keep an eye on that. It also makes sure that you get notified as soon as the opportunity to apply is available, because it can be very quick turnaround. If you look at the information in advance, it can tell you what information you need to provide for your application, and you can have that ready to go. So when the application opens, you're pretty close to submitting, with a few changes, maybe if there's been updates since the last time you put your materials together. Right now, for the scholarship programs, they kind of are looking for some very specific health careers. So folks who are in a program to become a MD or doctorate of osteopathic medicine, dentists, nurse practitioners, certified nurse midwives, and physician assistants. Things to know about it is that the payment of tuition and required fees is tax-free. They also provide some funds for costs like books and a monthly living stipend, but that is taxable. And your maximum funding can be for the full 4 years. For the Students to Service program, this is where you may be you're in your final year and you've decided now in that year, yes, I want to commit to working in underserved. This is a loan repayment program at that point. And this is a longer service, so it can be from 3 years to 6 years. And certainly dive into kind of what it means to be full-time and part-time. Some of this has to do with kind of hours that qualify in your service. And for some people, they want to do things like home health or work with a long-term care facility as a physician, and or other services. And so maybe all of their time may not qualify for the program, so they'll go part-time in one of these programs. Certainly one of the things that we say all the time with these presentations is read the guidance, read the guidance. Again, same requirements and same fields that they're looking for this loan repayment program. For the standard loan repayment program, it provides up to $50,000 for 2 years of service. It has actually a significant list of providers. So I again recommend to go online, and I'll put some links in the chat so you can find these services. But again, we have the Washington Health Workforce Gateway website, which has all of the links organized in one place for you. So we'll make sure you have that. Some other specialty things. So right now we're actively trying to address some of the specific shortages in our behavioral health providers. By the time you get to the point of a loan repayment program, this may be a different need. I kind of hope so. But right now, like, that's what happens with these programs. There are some standard ones that happen all the time, like our base National Service Corps program, as well as the Indian Health Service Corps program. But then when we have emerging health issues, they will create new programs to help address major workforce shortages or disparities. So these come with higher loan repayment amounts for those services. Again, they still require, with this program, being a United States citizen. And then they also have some requirements around kind of how you do work, and how you have to be fully licensed and actually working at the healthcare site that you will be applying with when you apply for this program. So that's the difference, is like you're in your program and you're getting a scholarship, you're at the end, you're going to do loan repayment, or you are now a working health professional in an underserved community and you're applying with your site to receive this funding. So where can you work? Well, what's great is the Health Resources and Services Administration has this big database where you can see where the healthcare safety net is, and you can see kind of where there are job openings and job descriptions. This is a great way just to kind of explore what kinds of job opportunities are out there to work in underserved communities. When we get to the state level, it's very similar to the National Health Service Corps. These are loan repayment programs. These are for professionals who are working in the community. But this has been a long-term program where the federal government helps support it, and state legislatures across the country help pass laws to support funding for this. So right now we have a federal program, a state program, and a behavioral health program that provide a maximum award of $70,000 to $75,000 for 2 to 3 years of service. And these are some of the health professionals that are covered in this program currently. And I'm a part of a committee that meets regularly to kind of assess where we have major shortages and long-term vacancies, to try to direct where the state funding goes on a more regional level. to address where these shortages are. So the national program, right, is kind of just thinking across the country, where do we have shortages? And then what the wonderful thing about the state programs are is that we can kind of help balance that out and kind of fill in where we're missing resources from the national program. At the Washington state level, you can basically do the same thing as with the Health Resources and Services Administration connector site, where you can go look where there are the sites that are already pre-approved to work. And then you can go on and look at their website and see what they're like to work there. Some of these facilities, sometimes you kind of imagine like, okay, they're underserved communities must be like really rundown clinics and really, challenging parts of town. Actually, some of these facilities are amazing. And some of these groups are doing the most amazing, innovative work. They're doing team-based care, and they're doing these really amazing like projects with community where, they're working on housing and food insecurity or wonderful community events. So there's a lot going on at these places that are beyond kind of just the standard healthcare work. And so it can be a really amazing community to join. So like I mentioned before, the Department of Health works with 3RNet to help kind of get this information out. They also help with recruitment. So when you're looking for a job, you can actually go to the site and you can sign up as a health professional and look for jobs in underserved communities. And if you'd like assistance, each state has a workforce advisor that helps you find jobs and does matchmaking for you. And this is a longstanding program as well. And they helped build our site for the Washington Health Workforce Gateway. So some key things as you're kind of moving forward. So with any of these programs, a lot of it is revolving around the facilities and sites that you're working on or want to work with, especially with the loan repayment programs. Paperwork, you don't want to make any mistakes on your applications. And that really kind of translates across applying for jobs, applying for college, everywhere. An eye on detail. We are seeing a trend lately of lots of people, even when applying for college, are not fully filling out forms, and that's the reason why they didn't get accepted. So really make sure, have somebody else look at it. Communication, not responding to inquiries. So like Sharon said, you need a good email, good voicemail. You always have to be in communication with any of these programs to make sure that you're fulfilling your responsibilities and you learn that you actually got accepted, and then you're responding in time to make sure you get that opportunity. Also, if you are accumulating debt while you're going through school, you don't want to consolidate school debt with other forms of debt. There are many loan repayment programs that are based around a health profession, or even other areas of loan repayment that may be offered by employers or other nonprofits, where it has to be specific education debt. And if you start mixing it, then you'll be disqualified to be able to apply that loan repayment. And then whenever you're doing a loan repayment program, you need to apply those funds to the loans. This is not extra money to help you buy a house or a car. It actually has to go towards your school loans. So this is the link. And I really appreciate your time today. And I hope that was informative. So that you can kind of think about what it takes to prepare and maybe some of the opportunities to work in underserved communities.